So, good morning, ma'am. I am your student nurse for today, and my name is Mayoras Garcia. So, may I know what's your name, please? Okay, so, Mrs. Descartin, for today, we're going to perform the Peri-Heat application. And before we proceed to the procedure, I'm going to check and assess your perineal area first to check if there is any swelling in the episiotomy wound and to check the discharges, the color, the odor, and now I'm going to expose your perineal area. Is that okay? Okay. So, the color was normal. There is any discharges, and there is a little bit swelling. And I'm going to remove the cream and ointments that were applied to you, so that we could prevent burning your skin. Okay? So this procedure was done to promote drying and healing of the perineal wound, to stimulate circulation, to prevent infection, and also to promote comfort and relaxation to the patient. So first, we have to review the physician's order, and it was stated here that we should use a 40-watt bulb and remove the lamp after 20 minutes of application, and also place it 18 to 24 inches from the patient. So this was used to promote a faster and effective healing of the wound. Then we have to gather the equipment and check it for safety factors to ensure orderly procedure. Then we have to bring the lamp to the patient's room to save time and energy. Then we have to explain the procedure to the patient to minimize anxiety and also to gain cooperation. So, good morning, Miss. I am your student nurse for today, and I'm going to perform the heat lamp treatment or Peri-Heat application. So, it is where application of dry heat to your perineum area with the use of the infrared light or lamp, and this is used to promote drying and fast healing of your perineal wound, to stimulate good circulation, and also to prevent infection, and also promote comfort and relaxation to you. So for nursing responsibilities, you have to check client's condition before applying the procedure and check all electrical equipment for defects or try to switch it on and off. Then always handle equipment with dry hands and check physician's order for each area to be treated and duration of therapy, and also do perineal flashing. Then we have to ensure that no more than 60-watt bulb. So we have to follow the physician's order, which is 40-watt bulb used for heat lamp or infrared element is in place for infrared treatment. So to ensure the patient safety and also the right amount of light needed promotes healing and effectivity of the given heat. We have to perform hand hygiene to prevent the spread of microorganisms. So next, we have to identify the patient by checking the name and identification band, or ask the patient to state his or her name and birth date. So, good morning, Miss. I am your student nurse for today. Can I ask what's your name, please? Next, you have to screen the patient to provide privacy. So next, you have to place the patient in the dorsal recumbent position to provide a full exposure of the female genitalia, and also to clean and dry the affected part thoroughly. So, Miss, I need you to flex your knees. And I will clean and dry your perineal wound. Okay? So next, we have to drape the patient diagonally to prevent unnecessary exposure of the body parts, and also to provide comfort and warmth to the patient during the procedure. So, we have to place the bath blanket or the top sheet over the patient so that one corner of the blanket is pointed towards the patient's head to form a diamond shape over the patient. Then, we have to instruct the patient to hold on to a bath blanket and request the patient to flex her knees and keep them apart with feet firmly in bed. So, Mrs. Cartin, I want you to flex your knees and then keep your feet firmly on bed, okay? Okay, thank you. So, after that, we have to wrap the lateral corners of bath blanket around the patient's feet in a spiral fashion until they are firmly covered. As well as to the other part. Then, the corner of the bath blanket between the knees and extending over the perineum can later be folded over the abdomen. So, this one. We can fold it when we're going to expose the perineal area. So, after that, we have to place the lamp 18 to 24 inches away from the patient to prevent burning the patient's skin. So, but before that, we have to ensure that our lamp was working. So, we have to test it first. So, we have to place it 18 to 24 inches away from the patient. So, I'm going to place the lamp and just tell me if you are experiencing any discomfort. And don't touch the lamp, okay? Because maybe it will burn your skin. So after that, after putting the lamp, we have to check for any discomfort, burning reaction, or other untoward reaction that may the patient feel or experience. And this could help to prevent any complications and always ensure that you do not leave your patient irrational alone. So, please, I will be here to monitor the progress and also to check if the lamp is still working and also to prevent any complications. So, do not be afraid because I'll be here to monitor everything. And please do not change your position so that we could finish this procedure smoothly and to ensure the continuous target area of exposure and to ensure your safety. Okay? Thank you. So, we've already finished the 20 minutes application according to what the physician has ordered. And we have to remove the lamp and turn it off. And after that, we have to check the perineal area of the patient for any burning or untoward reactions. So, as far as good, removing the lamp depending to the desired amount that was given by your physician could help preventing burning the skin of the patient or any untoward reactions. After removing the lamp, we have to reposition the patient to provide comfort and apply the vaginal pad. So this could promote relaxation and also rest to our patient. Okay, so now, Miss, I'm going to reposition you, and this could be provide comfort to you, and also I'm going to apply your vaginal pad. Okay, so now I'm going to check your area first, and then I'm gonna put your vaginal pad, and you can now straighten your legs. So, are you comfortable now, Miss? Okay. Then after that, you have to return all the equipments that you use, like the Peri-Light to the storage area to maintain order and safety. So for the evaluation, drying of the perennial wound and healing is accomplished, and then the circulation is increased to compromise the body area of the patient, and also there is no burning sensation that happens to the skin of the patient.